Hi, I'm Dr. Rick Duplantis, and you're watching It's Your Health. I want to talk about the spine tonight. We're continuing along with this series on the spine. Early on, I spoke about the cervical spine, and last week we talked about the lumbar spine, the low back region. Now tonight we're going to talk about the thoracic spine, okay? And you know, the thoracic spine anatomy we'll go over, and we're going to talk about the thoracic spine problems as well. I hope you're enjoying this series on the spine, and we'll go on and continue with this series tonight on thoracic spine. Okay, you know, thoracic spine is related to as the upper back or upper back pain. You know, it's important to talk about the anatomy, you know, of the complaint. So when people complain about upper back pain, they're usually referring to thoracic spine pain. You know, even though there is a lot of overlap from the lower cervical spine, the neck symptoms and upper back as the thoracic spine, most people refer to this thoracic spine region of 12 vertebrae as the upper back. Okay, so let's go into this. In the thoracic spine, the anatomy is a little bit different from the bones of the neck, the cervical spine, and it's also different from the lumbar spine as far as the biomechanics and the way the upper back can become a source of injury and the cause of pain as well from that area differs from that in the cervical spine and in the lumbar spine. And the reason being is that there is limited movement in the thoracic spine due to the attachment of the ribs. You know, the thoracic spine has a rib cage which makes it different from the cervical spine. You know, the neck and the lumbar spine of the lower back region. You know, the presence of this rib cage attachment to the thoracic spine is reduced motion to the thoracic spine, and it gives more of a rigidity, this lack of movement in the thoracic spine. Okay, and you know, the attachment of the rib cage reduces its motion and causes rigidity of the thoracic spine. It minimizes movement, in other words. The rib cage provides rigidity and reduces its motion, and it's due to the presence of the rib cage that causes a limitation in movement and restricts movement in this part of the anatomy. It's much different than you expect in the region of the cervical spine and the lumbar spine, where you have flexion, extension, you can bend forward, and you can bend your neck backwards, you know, but in the thoracic spine, we're somewhat limited, okay? And, you know, whereas in the cervical and lumbar spine, you see herniations, you see also disc degenerations, these are not that prevalent in the thoracic spine as they are commonly found in the cervical spine. Actually, herniations of the thoracic spine are considered very uncommon, to say the least. But most often, joint dysfunction and associated muscle and connective tissue inflammation and irritation is the most common cause of upper back pain. You know, many injuries of the upper back can be related to a lack of the level of muscle tone and fitness of the upper back region, or in performing some of the movements beyond the strength and fitness level of an individual and that muscle region. An individual will end up with upper back pain or thoracic pain, as we call it. You know, there's also an overuse syndrome that can also be the cause of upper back pain as well, in addition to overexertion, as we mentioned. You know, we can exert ourselves beyond the muscle's capacity to perform a certain task. Thus, this causes an irritation of the upper back region. It can be from excessive axial loading of the thoracic spine. As such, when someone places a barbell across their upper back to perform squats, would be a prime example of axial loading of the spine. Trauma can certainly bring about injury and irritation to the thoracic spine due to both muscles and through the injury of a nerve. Nerve injury can cause pain to the muscle it supplies, you know, thus causing mobility issues of the same muscles, which bring about pain and discomfort in the upper back region, the thoracic spine. We must note that posture plays a very important role in the thoracic spine and can create spinal disorders along with muscular pain in this region. Posture plays a role in allowing the forces of gravity to travel through the spine, its most optimal condition. The ideal posture is the neutral in nature, which allows gravity to travel through the spine evenly. For us, posture is somewhat habitual because as we get in the habit of carrying ourselves, our body, in one fashion or another, it becomes very hard to unlearn that bad posture and maintain good posture, reduce the upper back pain. Many people fall into this category. It happens. It's hard to relearn good posture habits and continue to apply them, but you must become aware of this. Our posture changes depend on the task which we are doing many times, such as our posture when walking changes somewhat from the posture when we sit, and it changes as well when we begin to bend over, such as when we're seated, bending over reading a book, or we're working at our computers. Our posture changes with each of these functions. It takes a great deal of conscious effort trying to maintain posture when we start to move or change positions due to these task orientations at hand, and we forget that posture presence, and we assume that the posture we had in the past, which may be producing the pain, discomfort in our upper back, was our natural posture. Our posture is changed with each new body position. Like I said, from moving from the sitting position to the standing position, from walking as well. Posture is constantly in motion, I guess you could say. The change in posture from one position to the other can place more strain and stress on various muscles of the upper back region, and to control these different forces due to the shift in body's position, there should be a balance through the proper distribution of weight due to gravity. So, getting back to posture becomes very important for the thoracic spine, especially as the biomechanics change with the body's positioning. Posture is affected each and every time. When explaining the thoracic spine, we have to note that the scapula, or the shoulder blades, as seen here on the diagram, are also known as moving on the thoracic cage attached and controlled by many muscles. As we can see here, the layers of the muscles on the back as they come in. These muscles serve for the movement of the upper back region. The many layers of muscles that we have as shown here on the screen. Okay. These same muscles, they give support and movement to the entire shoulder girdle and scapula as well. So this entire motion of the scapula and its ability to be stable depends on the muscular support it gets and the contraction of those same muscles in synchrony, acting in concert together, thus allowing the body to move in its various planes and positions and posturing. When we talk about the thoracic spine, we have to remember that the scapula, as shown here, all the shoulder blades really travel on the thoracic cage. Okay, and so they are controlled by a variety of muscles, as you can see here on the diagram. I'd like to point out that the scapula and the whole shoulder girdle is really supported mainly by muscles. Thus, where and when there's a nerve injury occurring, in an example such as a long thoracic nerve, which supplies muscles of the upper back over the scapular region, it allows the scapula to move and places a great deal of tension on the other muscles of the scapula, the stabilizing muscles, thus placing stress on a muscle group not meant to control this. So you end up with a general feeling of great pain and discomfort in those muscles, along with dysfunction of movement. Dysfunction of movement of the muscles, which cause more strain on the muscles, creating more pain and discomfort due to this change in biomechanics and posture of the spine. So of course, as you can understand, there are many reasons for upper back pain or overuse injury, or injury that comes from muscles that lack strength or tone due to being untrained, unfit, or weak and deconditioned. This can cause nerve injury, muscle damage due to mechanical changes in posture. We'll take a short break at this time, and we'll be back with the second half of this program. You're watching Cox Cable, Channel 16. It's Your Health. Hi, I'm Dr. Rick Duplantis, and we're talking tonight about the thoracic spine, and I'd like to continue. As you can see on the screen, we have the thoracic spine. The bones that make up the thoracic spine consist of 12 vertebral bodies that make up the spine of the thoracic region. Okay, and I want to go ahead and rotate the spine on my screen now so that you can see the back of the spine. We call this the posterior aspect. You're looking at the spine, the bony projection of the spinous processes. You also can see the facet joints that are made up by the vertebra above and the vertebra below, forming the facet joint, which allows bending and movement in the spine and other parts of the spine. But as we mentioned early on, in the thoracic spine, due to the attachment of the ribs, there is just minimal movement and some rigidity because of the attachment of these ribs to the vertebral bodies, to the vertebrae of the thoracic spine, and also come around to become attached to the sternum. Okay, so we'll go ahead and continue on with this, but I wanted to show you separated, and now we're going to go ahead and separate out. Let's distract the bony segments of the thoracic spine. There. So we are separating out, and you can see the 12 bones that make up the thoracic spine, and now how they come together, one on top of the other, to show the actual spine itself from the front, which we call an anterior view now, where you can see the body of the vertebrae, and then a side view of the thoracic spine without the ribs, so that you can see the actual openings where the nerves are coming out. Remember, we call these foramina. These are the holes that the vertebra allows the nerve to exit. The peripheral nerve exits the spinal cord through the foramen, the opening produced in the spine. And as you can see here, and then we turn around and we'll show the back of the spine. Okay, now we have many reasons for upper back pain, like as I mentioned. And then, we can have overuse injury. You can train too hard in a workout, or you can do something that you haven't done for a long time, work an area of your body you haven't worked. You can be doing a project at home, climbing on a ladder and working overhead. It can strain your upper back as well. We call this overuse injury. Comes from muscles that lack tone, actually, and it's due to weakness and lack of use, deconditioning. It can cause quite a few problems. It's very important to diagnose this correctly and eliminate nerve injury from the equation, and eliminate any kind of trauma as a cause for the injury or the reason that you're having upper back pain. Now, treatment for upper back pain really is aimed at addressing the supporting muscles of the upper back, and that includes the scapula stabilizing muscle group, as shown here. We can see the muscles of the scapula and the muscles of the upper back together. The muscle groups that support the spine should be addressed and treated as well. So we're actually really treating the muscles themselves when we have upper back pain. Stretching the opposing muscles should be included in the treatment of upper back pain. In other words, we really want to balance the muscles in and around the spine and the scapula in order to recreate that function and balance that was lost, that's lost as a result of a strain or injury to the upper back muscles. So when you have upper back pain, you're really talking about upper back muscles that have become strained or stressed through overuse syndrome as well. So also other times it's necessary to treat the muscle itself, so that if there is any trigger points, trigger point is, these are knots that form in muscles. If you ever felt somebody's back, the upper back and the neck, and you feel those hard points in the muscles, they kind of feel like they have knots in their muscles. And these knots, they're called trigger points. They are what we call myofascial irritation. These are very tender points in the muscles, and these knots in these muscles are capable of spreading the pain along a pathway of that entire muscle itself. So those can be eliminated through, releasing the myofascial trigger point release, which I do in my office for my patients. It can also be relieved through manipulation, which is a very specific trigger point myofascial release technique can be used. And some physicians actually go as far as putting a needle into the trigger points and injecting a fluid to break up these trigger points. In my practice, we work these trigger points with various techniques to allow these muscle knots, these knots in the belly of these muscles, to become released. They call it myofascial release technique. And we practice this in my office when I have patients, and I see trigger points frequently in my patients with upper back pain, especially trigger points in the muscles of the upper back, the trapezius muscles, those big muscles that come off of the neck and kind of go down the upper part of the back, the trapezius, or traps, as they're called. We will recover from normal movement and we'll get our normal function back when these muscles are treated, through therapy, and they can retain their normal postural physiological state. It's important to treat these underlying nerve problems if those exist. As a doctor of chiropractic, we manipulate or adjust the upper back. This manipulation of the spine releases and helps to release these trigger points. We break up a lot of the muscular adhesions in and around the muscles and the capsule of these vertebrae of the thoracic spine, thus allowing the spine to be loosened as a result. An elongation of these tendons and these muscles. They become shortened maybe as a result of strain or sprain. As I said before, correcting postural habits along with chiropractic manipulation, therapeutic exercise, myofascial release, the use of ultrasound, and massage, all of these is important. All these techniques are important in addressing the pain in your upper back regions, and this is how I approach it. Now let's talk about spinal problems that can cause upper back pain. Sometimes you have what's called intrinsic spine problems. These may very well give rise to and be a cause of a lot of upper back discomfort, pain, and even somewhat dysfunction, and they should be considered in the diagnosis and treatment of upper back pain conditions. Some of these spinal conditions are such as a spinal fracture, degenerative disc disease is another. You can have a herniated disc. You can have also a condition called spondylolisthesis, which is the anterior slippage of the vertebral body above on the vertebral body below, or even spondylosis, degeneration. Proper diagnosis of these conditions is very important. The physical examination's objective is to elicit the pain by provoking pain through different positions of the body, and then percussion by tapping over the spinal segments, as well as checking for spinal fractures. By doing a thorough examination in my office, I take very great deal of time and thoroughness in checking the thoracic spine out, tapping on the spinous processes to see if they elicit pain. Also, examination with the hands, palpating the spine, feeling which segments give rise to tenderness or irritation. These findings can point to the cause of the problem and allow more specific workup for that region of the spine through more specialized tests. Spinal fractures usually occur from osteoporosis or brittle bones, as we know them to be, where the vertebrate's density is decreased and the vertebrate literally collapses, which can occur on its own from trauma as well. Even normally healthy vertebral bodies can fracture as a result of trauma to the spine or the exertion of great force to that vertebral body, and they undergo a compression fracture. It's the movement of the segment, that motion of the fracture of the bone, the spinal vertebra, that causes great pain when it's fractured. If you fracture a spine segment in your back, the vertebral body, and you have a compression fracture, you will know it. It's severe pain. The motion of the fractured segment gives rise to severe pain when it's fractured. The degenerative disc disease, degenerative process, is also not a very common finding, believe it or not, when it comes to the thoracic spine, the upper back region, because there's so little movement in the upper back, in the thoracic spine, due to the rib cage, so that you really don't have a lot of degeneration between each bony vertebral body, each bone of the thoracic spine. However, it is possible and thus proper to do radiographs, also known as x-rays. They must be obtained, do a diagnosis to be properly able to diagnose that segment. When we don't see a lot of herniation, however, in the thoracic spine, as I mentioned, because there again, it goes back to the limited motion of the thoracic spine. I'm not saying it's totally impossible, I'm saying it's not common. Okay, there again, we can't exclude it or rule it out forever occurring, but we must be concerned of that remote possibility in the back of our mind. I talked about spondylolisthesis, big word for the vertebral body slipping forward on a vertebra below, and it's limited in occurring in the thoracic spine. And this is due, like I said, to its limited movement in the thoracic spine. So I've named three conditions: herniation, degeneration, and spondylolisthesis, which all are very uncommon in the thoracic spine because of the rigidness and the lack of movement that takes place in this region of the back, or of the spine, in other words. This being stated, in the case of severe trauma to the spine, this can and does occur in the thoracic spine. Severe trauma is likely to cause spondylolisthesis in the thoracic spine. With all of these remote possibilities occurring normally and frequently in the upper back, the thoracic spine, we should note that nonetheless carry out a thorough examination, and your doctor will be keeping all of these factors in mind. So forces that keep the vertebra from slipping are no longer there. And there's another force that can be in excess of what one vertebra can support in another, and the vertebra ends up slipping on top of that vertebra right below it. And like I said, spondylolisthesis is the name given to that condition. It's caused by severe trauma, and not necessarily just from normal wear and tear in the thoracic spine. Okay, and this is due to the rib cage. Spondylitis can occur in the thoracic spine. It's simply a general arthritic change, is what this means, that takes place in the joints we call the facet joints. The facet joint, as we mentioned before in previous lectures here, are formed by the vertebra above and the vertebral body below, and the back of the vertebral body. These come together to form a capsule. They form the facet, which that's the segment, the joints in the spine that allow us to get movement, to bend over and to move in various planes. Know that a fractured, in the spine is a serious problem. Now we're talking about facet joints. These joints of the spine, they give rise to our movement. They can give rise to spine pain, which is brought on by movement and should be explored on x-rays, which are sufficient to evaluate the condition of these various structures. How else would your physician know, would your doctor know, if you have any arthritic changes in these facet joints and that are causing the pain? So they'll take an x-ray of the spine and looking for arthritic processes. They'll look at these facet joints in the spine to see if they are hypertrophy, they're enlarged, if they have arthritic condition. And sometimes, these facet joints are injected with an anesthetic agent into the facet segment to see if it minimizes the pain. If it does, this is a diagnosis in of itself, and it also eliminates the pain. It's called diagnostic blocks. Now, diagnostic blocks are helpful in diagnosing facet-mediated or facet-caused spinal pain in the thoracic spine, the upper back. If the block eliminates the pain totally, the doctor has his diagnosis of facet-mediated pain. A herniated disc in the upper back in the thoracic spine can occur when this inner-like jelly material of the intervertebral disc leaks out to the outside of the disc. You have to think of a jelly donut and the jelly squirting out of the donut itself. This is kind of like what a herniation of a disc kind of occurs. There's a squirting out of this jelly inside the disc material, which ends up on the nerve, causing a great deal of pain and discomfort. A thoracic herniated disc can cause a great deal of upper back pain and other symptoms such as radiating pain or even numbness. So specific symptoms of thoracic herniated disc are usually different depending on where this disc herniates, as the herniation disc material in the upper back can either impinge on an exiting nerve root or on the spinal cord itself. And this kind of pressure on the nerve root causes a great deal of pain, and this can give off a chemical compound when the nerve is touched by this disc material, and it gives off these prostaglandins. Prostaglandins is a biochemical compound in the body that's produced, and it causes pain. It causes pain in the spine. You can also get a radiation of pain as well in the thoracic spine. We'll take a short break here, and we'll be right back with this program. Yes, I'm Dr. Rick Duplantis, and I want to thank 3D4 Medical for the use of these medical illustrations shown on today's show. Thank you. Okay, Dr. Rick Duplantis, you're watching It's Your Health. We're talking about the spine tonight, and the part of the spine we're talking about is the thoracic spine, the upper back and other regions. Okay, I talked about spondylolisthesis, okay, and it's caused by trauma in the thoracic spine. And the term spondylolisthesis comes from the anterior slippage, movement forward of the vertebra above it on the vertebra below. Okay, so it kind of looks something like this on a radiograph. Okay, it's usually due to a fracture of the pars interarticularis of the vertebra. So I wanted to show you this model where you can see it clearly. This is a normal position. Say this is the thoracic spine vertebra, and a spondylolisthesis would be where it's forward, slipping forward, and it can be first degree, second degree, and a third degree slippage, depending on how far the vertebra slips forward on the vertebra below. Okay, so normal vertebra body, then anterior slippage causing the term spondylolisthesis, and like I said, it can go grade 1 and grade 2 and a grade 3 depending on how far it actually protrudes out. With this spondylolisthesis, as you can imagine, the nerves are exiting here on the vertebra, as shown in this model, between the openings of two vertebrae. Okay, the condition of spondylolisthesis, where it's a forward movement due to a fracture, can cause constriction and put a lot of pressure on that nerve root exiting at that spinal segment. So I just wanted to make this clear for you in understanding what the term spondylolisthesis actually means. Okay, we talked about herniated disc. I have a model to demonstrate that. We talked about the jelly donut, and the jelly being your disc material as it squirts out. So I've got a disc here, and it's got a model for a herniated disc. I'm going to remove the very top vertebra so that you can see down the center of it, and this is what it looks like, okay? And this would be a herniated disc where the material inside the center, which is wrapped into a capsule, becomes extruded or kind of squirts out like the jelly donut, like the jelly of a jelly donut. And this disc material becomes extruded out to the nerve root itself, causing, as you can see here, pressure. And this pressure can cause a great deal of pain and radiation of pain. It can also cause a reaction in the production of prostaglandins, which this compound can produce pain in the human body. And that's why we take non-steroidal anti-inflammatory agents, because they block the production of prostaglandins, as do corticosteroids that are given when someone has an acute type of inflammation in the lumbar spine, or in the thoracic spine or cervical spine. So we're going on to another topic here. Like I said, you have a lot of movement in the cervical spine and the lumbar spine. You have very common problems that occur there that you don't have in the thoracic spine, and those would be herniations, those would be degenerative joint disease, and even spondylolisthesis as well. We're talking about, and when we talked about the cervical spine, the neck, we talked about the majority of the stress, and the neck is placed upon C6 and C7 vertebra. Okay, those are bearing the brunt of the weight. We talked about the lumbar spine, the low back, where the level of L4, L5 bears the brunt of the body's weight, and thereby that's where the injuries will occur. This is where the herniations will occur more often at C6, C7, and also an L4, L5, and S1, because of the weight-bearing ability of that part of the spine and how it functions in biomechanics and movement of the spine. Now, the majority of upper back problems in the thoracic spine, these occur from the level of T8, the 8th thoracic, to T12. And this is a thoracic, or we call it the thoracolumbar region of the spinal column, because of its junction in the mid-back, okay? As mentioned, the thoracic disc disorders, such as the herniation, make up a very small percent of problems in the thoracic spine. Now, there was a study conducted where 90 asymptomatic patients, in other words, patients who had no pain whatsoever, or no symptoms in their upper back region, were evaluated and were subject to MRI scans. Now, here's the findings. The findings of these MRI scans of the thoracic spine, the upper back, in people who had no pain and revealed no pain on questionnaires and had no symptoms of back pain, 73% of these patients were found to have disc abnormalities in the upper back, such as thoracic herniated disc and thoracic degenerative disc disease. And 37% specifically had thoracic herniation in the thoracic spine without symptoms, and 29% had radiographic evidence of spinal cord impingement identified on an MRI. Now, bear in mind, these patients were followed for about 26 months after, and none of them developed thoracic back pain from their thoracic disc disorders. Interesting findings, to say the least. This shows that these people had these disorders and they were found to be pain-free. They may as well be found, sometimes you can find these on incidental findings as well, when a physician is looking at other things in the spine. It's important to note that there are many causes of upper back pain, and that many much more common than a herniated disc, and the correct diagnosis of the cause of the pain is more important than whether or not an MRI scan can show thoracic disc herniation or not. As we say, the causes of upper back pain and how to treat it depends on the underlying cause of the condition. Even in cases where it seems obvious of what started out to be upper back pain, such as an injury from a fall, the specific source of pain within the body can sometimes remain elusive. You just don't know where it's coming from. Strains in the muscles of the upper back pain are common, and they're a common cause of pain in the upper back region. This is due to strain of these upper back muscles, as shown here on the diagram to my left. Oftentimes, this pain is from straining of the intercostal muscles. Now, the intercostal muscles are the muscles between the ribs. I don't know if we can show you on our model here of these intercostal muscles that interconnect between the ribs. Okay, now we can see these. This can give rise to upper back pain. So intercostal pain, strain or sprain to the muscles between the ribs themselves can cause upper back pain. Most upper back pain is often due to an injury that resulted in a muscular irritation, such as the strain or overuse syndrome in the upper back muscles, as well as joint dysfunction. Some common causes of upper back pain are, like I said, the posture, the way we stand, the way we sit, and especially our posture while sitting and working at our computers. A sedentary lifestyle can cause upper back pain due to deconditioning of the muscles of the upper back. These back muscles are out of tone. They're not fit. The poor posture can cause actual structural changes in the upper back, believe it or not. And even bad posture can cause neck problems. Our muscles, due to sedentary lifestyle, cause a loss of tone and strength as well in muscles, and they become weakened and deconditioned. Thus, they affect the way we hold our spine. Now, can you imagine if you're untoned and your back muscles aren't strong or strengthened, and if they're weak, your posture is going to be reflected in your posture, because your posture is going to be bad if your muscles are not toned or if you're deconditioned. When our head and our shoulders hunch forward, this places pressure on the bones of our spine, on the muscles and ligaments in the disc of the spine. When we lean to one side while sitting, driving, or working at our computer, this can lead to upper back pain. So, when it comes to lifting, if we're not lifting properly with a proper technique, this can cause a great deal of upper back pain as well. Improper lifting technique, lifting a heavy object without keeping the spine aligned can put undue stress on the upper back musculature. When we lift these very heavy objects overhead, this causes both upper back and shoulder injury, especially in the person who is deconditioned or unfit in this particular muscle group. Now, like I said, lifting heavy objects overhead can cause a lot of pain. And sedentary individuals who are deconditioned and lack good muscle tone and good strength in these muscles. Another cause of this upper back pain due to the muscular system is overuse of upper back muscles. When we put more stress than usual on our spine, we try to do something different, we're taking on a home project, and we're able to have to put ourselves in an awkward position, and we're straining, lifting things overhead. This results most oftentimes in an upper back strain in an individual who is deconditioned. These movements, these positions, they put us at risk for causing many strained and pulled muscles and ligaments. And this can cause a lot of inflammation in the upper back. Inflammation gives rise to pain. Now, we're talking about trauma. Let's talk about motor vehicle accidents, such as the auto accident, motorbike crashes, or someone falling from a roof, or you can fall off a ladder. This causes a lot of upper back pain and strain, and it injures the spine, causing problems with the muscles, ligaments, and even can affect the disc of the thoracic or upper back spine. Oftentimes, the upper back strain and pain can be from improving lifting techniques and trying to lift something that's just beyond your ability. You should gradually work up to handling heavy poundage. If you're exercising, doing lifts overhead, you start out light and gradually build up to heavier weight. Things that are seldom the cause of upper back spine pain include, like I said, to recap, the thoracic herniated disc. We showed you here what the herniated disc actually looks like, okay? Puts pressure on the nerve root. This can occur. It's not, common, but it can happen, and it's rarely. You have an age-related degenerative disc breakdown. You have arthritis that can occur, degeneration in the lumbar spine, as well as the aging process can bring this about. Compression fractures, we talk about, fracturing the actual bone, the vertebral body can be compressed upon itself. These compression fractures are often found in elderly adults due to the condition of osteoporosis, the brittle bones condition. The vertebral body becomes very weak, okay? As you can see, this is the body. It becomes very weak and then can become unable to support the weight of the vertebra above it, okay? And we'll show you with a large one here. Here we go. And so it can't support the above vertebral body, and so this becomes compressed. This vertebral body here will actually compress and collapse, and we have a compression fracture in the back. And this can be due to osteoporosis, brittle bone syndrome as we age. This wedge-shaped vertebra that will lose its height as a result can cause postural changes in and of itself and a great deal of upper back spinal pain. There are many different types of arthritis that take place in the thoracic spine. One of them, I already mentioned, is osteoarthritis, which is from age, wear and tear of the bones of the thoracic spine. But also another form of arthritis can occur in the thoracic spine called rheumatoid arthritis, which is an autoimmune condition. It can occur in the thoracic spine. Other causes of upper back pain or thoracic pain is fibromyalgia. It can cause a dispersed pain and fatigue throughout the upper body and upper back. It's most commonly involved in fibromyalgia. It's several points in the body that give rise to pain, both in the upper and lower extremity. Now, spinal deformities such as a Sherman's kyphosis or scoliosis, both can be a source of great pain and discomfort in the thoracic spine, in the upper back. Tumors and infections of the spinal cord can also be a cause of upper back pain and discomfort. As we age, there is an increased risk for upper back pain, simply, like I said, from this wear and tear phenomenon, and it's more so in the lower back and neck, however, than it is actually in the upper back or thoracic spine. And might be puzzling to many people, but I think if you are maybe an individual who has done a lot of weight training throughout your life and done a lot of heavy squats, when you place that bar across your shoulder, you get what we call axial loading of the thoracic spine. And years and years of heavy squatting with the weight across the shoulders can cause a little degeneration in the thoracic spine. I beg the question that you can't have it. You can, but it's rare. And although hard to believe, the older adolescents even are more at risk than the other two age groups for upper back pain and discomfort. Now, other risk factors for developing upper back pain include having weak abdominal muscles. Who would have thought that? And then upper back muscles. Also, more common is upper back pain in female than it is in male. And also musculoskeletal pains, such as fibromyalgia, can be one of the causes of upper back pain. We want to address the treatment of this upper back pain. If upper back pain develops without any major signs of any emergency, most people can safely try to alleviate the pain on their own. Okay? Maybe the application of ice, or after a couple of days, a good hot soak, sitting in a hot tub, whirlpool, may be enough to relieve the upper back pain. There's several self-care treatments for upper back pain. And the combination of one or more of these treatments may be all you need to reduce the pain. But one way of improving upper back or correcting your upper back pain and relieving it is correct sitting posture. Modifying your seating posture can help to manage upper back pain during the workday. Some early treatment options to try when upper back pain develops include, you might want to take it easy at first and then try using ice to the area for the first couple of days. And you want to modify your activities. You don't want to be as active, and you don't want to do anything strenuous during that period of time when you have this upper back discomfort. Now, if the pain gets worse with certain movements or activities, such as doing household chores or participating in hobbies or sports, you might want to take a rest from these activities for a few days until this kind of disperses. You want to avoid the activities that irritate the upper back pain, and you don't want to try to over-exercise or exercise through the pain and discomfort when you have upper back pain. You need to take some time away. You need to stop the activity for a couple of days. You can't work through a strained muscle. Give yourself a few days of rest, then come back and try to do maybe some light exercises, some slow stretching, some mild stretching at the same time, and listen to your body. If you feel like you can tolerate more, do a little bit more. If you wait too long, however, to become active again, this can cause muscular weakness in the upper back, can lead to more pain and discomfort actually. Like I mentioned, I like ice the first 3 days. Then I feel you should try adding moist heat in the form of a hot tub, whirlpool bath, or let your hot shower pulsate on the upper back for several minutes when you're taking your morning or evening shower. I usually tell my patients 20 minutes on, 20 minutes off when it comes to using ice for the first 3 days, and 20 minutes on, 20 minutes off when it comes to using heat as well on day 3 and thereafter. You want to check your skin when you're using ice or heat. You want to make sure that you're not irritating the skin from the ice pack being in direct contact with the skin. You might want to use a towel, and you might not want the heat to be too dramatic, and you want to place something between your skin and the moist heat as well. A towel would serve you well to do that, give you that insulation. Many people, when they have any kind of back pain, they reach for over-the-counter medications. Let me say this, do not take more than one kind of medication at a time. In other words, don't take Tylenol and ibuprofen at the same time. And you don't want to mix an ibuprofen with something called naproxen or Aleve. When you mix these type of drugs, it can damage your kidneys, and you can develop various problems and issues causing tubular interstitial cystitis. And the tubules become damaged, and so don't mix anti-inflammatories. Always talk to your doctor. Get your doctor to advise you on what's best for you, even when it comes to over-the-counter medication. See your family physician and take his advice, okay? And like I said, taking non-steroidal anti-inflammatory drugs, from my medical training, you can end up with kidney problems. The average individual who is healthy with no kidney issues can take non-steroidal anti-inflammatories. It's not a problem. They can take them for a few weeks or so. But long-term use of non-steroidal anti-inflammatory drugs like would be Aleve or ibuprofen, over-the-counter type medications over a long period of time for a year would be causing damage to the kidneys. But always check back with your family doctor, like I said, and get his input on these. But long-standing use of non-steroidal anti-inflammatory drugs, NSAIDs, cause what we call a term called analgesic nephropathy, damage to the kidneys from taking non-steroidal anti-inflammatory drugs. Consult your doctor if you have any questions about your ability to take over-the-counter meds when it comes to NSAIDs, okay? I want to talk to say as well, the way I address upper back pain in my clinic is, I apply moist heat, may apply muscle stimulation to relax the muscles, but as a chiropractor, as a doctor of chiropractic medicine, I adjust the spine through specific chiropractic manipulative techniques to go down the thoracic spine, adjusting the spine to relieve a lot of this discomfort in the spine itself. A lot of times, the muscles in the spine can shorten and tighten. When we go in and I do the spinal manipulative move or therapy in the thoracic spine, it breaks up muscular adhesions. It elongates these muscles that have shortened as a result of muscle strain and sprain. And these muscles shorten, we have a limited range of motion, and they give rise to a lot of pain and discomfort as well. And when we do the manipulative therapy, it breaks up these muscular adhesions and increases the range of motion of the joint segment that we manipulate, that we adjust, thus providing great relief of pain, discomfort, and increasing movement in that part of the spine. Okay, so wanted to interject that here. Well, I hope you've enjoyed tonight's show on the thoracic spine, or the upper back as we call it, and I hope that you've gained a lot of knowledge and a few points on how to treat some of these upper back pains and discomfort and what they are caused by. I'm Dr. Rick Duplantis. I want to wish you a very pleasant and good evening. God bless.